Policy and Medical Advisor at amfAR and former Assistant Surgeon General of the United States. On behalf of amfAR, the Foundation for AIDS Research, the sponsor of today's conference on Making AIDS History, From Science to Solutions, I want to welcome you to what we hope will be a very exciting afternoon. At this summit, leading scientists, policymakers, and advocates will track trends in the AIDS epidemic over the past 3 decades, highlight the progress that has been made, and discuss roadblocks as well as unprecedented opportunities for successfully implementing a roadmap to end AIDS in our lifetimes. We want to thank each one of you here today, the warriors in the fight against AIDS, for joining us and for your dedicated leadership that reaches across organizations, across disciplines, across the aisle, and across countries, working together with a common vision and a common mission to make AIDS history. It is this shared responsibility and shared humanity that brings us here today in the fight of our life against the leading infectious disease threat worldwide. Our thanks to Senator Tom Harkin, Chairman of the Senate Health Committee, to Senator Chuck Schumer, Chairman of the Senate Rules Committee, for their tremendous leadership in the fight against this disease and for their assistance. And our deep appreciation to the marvelous Molly Click from the Health Committee for her expert assistance, and to Jenny Tran and Kaylee Peters of Hayes and Associates for their outstanding work. I also want to acknowledge our superb amfAR Washington, D.C. team, Khalid Lindsay, Deputy Director of the Policy Office, Jack McAllister, our Research and Policy Assistant, Paula Brooks, Office Manager, and our terrific Rosenfield Policy Fellows, Sarah Robbins and Nagar Amerigan. And from New York City, my deep appreciation to Kenneth Cole, amfAR's dynamic Chairman of the Board, and also to our communications team, including Anne-Marie Shanahan, its Director, Andrew McGinnis, and Joanna Casas. And a warm welcome to Greg Millett. Greg, would you stand? Who next month will become Vice President for Public Policy at amfAR. He's a gifted policy analyst who played a critical role at the White House and at the CDC in crafting the National AIDS Strategy. And we are very proud that he will soon join the amfAR team. Colleagues, this week marks the 30th anniversary of the identification of the HIV virus, the virus that caused AIDS. Since that time, the disease has ravaged communities and continents, devastating individuals, families, and the development, economic growth, and stability of nations. As recently as 10 years ago, experts warned that we were at the point of no return. Globally, over the past 3 decades, more than 75 million people have been infected with HIV, and half of them have died. Over 600,000 Americans have lost their lives to this disease. And this year, every 15 seconds, another person will be infected with HIV worldwide. And every 9.5 minutes, another individual will be infected in America. There is a city where 1 out of 31 people is HIV positive, and that city is not located in the developing world. It is, in fact, Washington, D.C., our nation's capital, where the prevalence rate is higher than that of some African nations, including Ethiopia and Ghana. But as we will hear today, for the first time in history, we are at a tipping point towards reversing the pandemic, with significant declines in deaths and new infections in some parts of the world as a result of investments in HIV/AIDS research, treatment, and prevention. As a result, more people than ever are receiving life-saving antiretroviral therapy, and those who have access to it can expect to live a long life. As a result, we've seen historic declines in AIDS-related deaths worldwide, dropping more than 26% between 2005 and 2012 to 1.5 million. The annual number of new HIV infections has also dropped to 2.3 million in 2012, a 33% decline since 2001. Moreover, infections among adolescents and young adults has decreased by 50% in 26 countries during the same period. How has this happened? It's happened because the people in this room work together with partners across the world to develop and implement a roadmap to end AIDS. And as a result, we are witnessing unprecedented progress from science to solutions towards eradicating one of the greatest public health crises of our history. Investments in science have paid life-saving dividends, including medications that have transformed a lethal disease into a chronic disease for many. Innovative programs and financing mechanisms, including PEPFAR and the Global Fund to fight AIDS, TB, and malaria, were established and deployed, expanding access to treatment and prevention services while building and strengthening sustainable health systems in countries around the world. Public and private partnerships have been a cornerstone of these efforts. But this stunning progress is fragile, given fiscal constraints and budget battles. While United States investments in global health account for just less than 1% of our nation's budget, they significantly advance American security, foreign policy, and humanitarian objectives. These are the tools of smart power in our interconnected world. Yet this year, the global fight against HIV is facing a decline in international resources despite the huge unmet needs that still remains. Shamefully, as of 2013, only 34% of people globally who needed treatment had access to life-saving therapy. AIDS is the leading cause of death for women of childbearing age, but only 64% of HIV-positive women receive services to prevent transmission to their infant, and fewer still receive services to protect their own lives. And in the United States, of the 1.1 million people living with HIV, only 37% are receiving ongoing care, and just 25% are virally suppressed. Furthermore, looming budget cuts threaten AIDS research, a potentially significant setback for the prospect of new scientific discoveries that are urgently needed to prevent, treat, and cure the disease. The bottom line, we are at a critical moment of decision to either win or lose this war. Will we work together to implement national and global strategies? Will we invest the resources? Will we fight to overturn the stigma, the discriminatory laws and policies that exist today? Can we marshal the political will to make AIDS history? That's what this conference is all about. Since the emergence of the epidemic, amfAR has provided pioneering leadership to end AIDS with the support of cutting-edge HIV prevention, treatment, and cure research, and the career development of AIDS scientists. amfAR also works to advance evidence-based public policies in the United States and globally, and amfAR convenes leading experts to chart new frontiers, to forge partnerships, and to take action. That is our goal for today. We've heard today from our superb speakers that much is being done to accelerate progress in the fight against AIDS. But looking forward, what remains to be done is to further harness scientific and technological innovation, political will, and public awareness, mobilizing all sectors of societies worldwide to address one of the most public and most pressing challenges of our time, AIDS. The bottom line is that if we capitalize on new research, while expanding the deployment of the proven public health tools and programs already available to us, we can save millions more lives, radically reduce human suffering and new infections, and realize savings in healthcare costs as well. Today, our distinguished speakers, champions in the fight against this disease, underscored that to achieve a world without AIDS, countries must share responsibilities and work together to strengthen efforts and commit the resources needed to end the epidemic. Universal access to equitable and efficient healthcare is a cornerstone, and so is maximizing strategic partnerships. Innovative initiatives, including PEPFAR and the Global Fund, and the U.S. National AIDS Strategy must be fully supported, scaled up, and strategically deployed and targeted to population groups at risk. Global investments in research are a pillar of these efforts because research is medicine's field of dreams, from which we harvest life-saving dividends. And that is why science must be expanded in the years ahead to produce a harvest of new innovations in treatment, testing, and prevention, including a vaccine and a cure for AIDS. Importantly, as you heard from our speakers and Dr. Kim, the social drivers of the epidemic and the glaring global inequities, poverty, violence, lack of education, stigma, gender disparities, and discrimination against the LGBT community and people with HIV must be eliminated. This is our roadmap for an HIV-free generation and a world without AIDS. And each one of you here today plays a crucial role in achieving these life-saving goals. Your commitment and your leadership are essential. From the founding of our nation, every generation of Americans has been called on to do exceptional things against seemingly insurmountable odds. In 1961, President John Kennedy, for whom this meeting room is named, in response to the national security threat that was posed by the Russian Sputnik satellite, announced that America would put a man on the moon in 8 years. He said that as a nation, our scientists would develop metals yet undiscovered, to craft a rocket ship that would go at speeds undreamed of. We would do this not because it was easy, but because it was hard. Because the challenge is one that we were willing to accept, and that it was one that we were unwilling to postpone. President Kennedy said, "We must be bold." As you heard this afternoon, amfAR believes that ending AIDS is the moonshot of our generation. And colleagues, we must be bold. We are the first generation that has the scientific, the technological, and public health tools to prevent, treat, and cure AIDS, and to put an end to needless suffering worldwide. So let me conclude this afternoon with the entreaty of amfAR's co-founder, Dame Elizabeth Taylor, who testified to Congress 28 years ago. She said, "It is my hope that the American people and our leaders meet the challenge of AIDS rationally and with all the resources at their disposal for our sake and for the sake of all humanity." On behalf of amfAR, our gratitude to the distinguished leaders who shared their knowledge and vision with us, and our special thanks to each one of you here today, the dedicated advocates, the scientists, the healthcare providers, the policymakers, and the people with HIV/AIDS. You are the heroes in making AIDS history. So let us continue our work together so that we can soon reach the time when children have to turn to the history books to learn that there was ever a disease called AIDS. Until that time, thank you very much.